The COVID-19 pandemic has been casting a harsh light on longstanding social and racial divides. According to a new report by the Metropolitan Area Planning Council, these even include a racial divide in air quality. That means consequences for public health, and it stems from decisions made years ago about housing and transportation. To tell us about the report is the co-author, a senior land use and transportation analyst for the council, Dr. Conor Gately. Thank you very much for being with us, Conor.
My pleasure. Thanks for having me.
Conor, the one thing that was not very surprising about your report is the map of where these problems are worse for people who are not familiar. Walk us through that a bit.
Well, the two things we looked at here really were where do people live and who are the people living close to roads with high levels of pollution? And then where are the roads with high levels of pollution? And so the map, unsurprisingly, looks like a map of our major roads. The major highways, the major arterial roads, they all carry large amounts of both cars and trucks every day, high volumes, often in congested conditions. And congested conditions are a primary contributor to increased levels of air pollution from those vehicles. When we look at where people live,
Well,
go ahead.
yeah. Where are these neighborhoods where people are more exposed to that problem?
Well, what we expected to see was in the inner core, in the denser areas, there are more people living closer to roads with high levels of pollution. But broadly across the MAPC region, something on the order of 88% of all residents live within 150 meters of a road with a substantial amount of traffic volume. So while in the inner core and the denser areas, there may be more people living next to these roads, broadly, everyone lives pretty close to a big road. It's a dense part of the state, it's a dense part of the country.
Well, this, as you point out in the report, this is more of a problem for Black and Latino residents. I'm thinking of places like Roxbury, East Boston, and Chelsea. So if it's more of a problem there, what's in the air that is so harmful to these residents?
Well, what we looked at was a pollutant called nitrogen oxides. It's a collection of pollutants. In our model, we estimated the amount of nitrogen oxides generated by every vehicle, car, or truck, or bus on every road segment across a year. And for this particular pollutant, we used it because it correlates very strongly with something called ultrafine particulates, which are very, very small particulates emitted from the tailpipes, mostly from diesel vehicles, so trucks are heavily implicated. And these tiny particles get deeper into your lungs, and so they're a strong predictor of increased risk of pulmonary disease or cardiovascular inflammation. And in neighborhoods with heavy truck traffic, including some of those neighborhoods you just mentioned, as well as neighborhoods with lots of congestion and stop and go and slow moving truck traffic, this pollutant is emitted in the highest quantities. And so for those neighborhoods with large populations of color, they're also through a variety of historical, determinants of where housing was built, where affordable housing is available, discriminatory aspects of the housing market in terms of redlining and blockbusting. Populations of color are co-located in the Boston region with these roadways that carry a lot of high polluting vehicles.
Well, the problem with these fine particles is how they interact with other health factors. So what goes on here, especially now that we're having this pandemic?
Well, this has been a persistent problem pre-COVID-19, but what was underscored, I think, in the past few months as we have seen pronounced racial disparities in the fatality rate from COVID-19, ties back to the fact that people of color are at higher risk of having these pre-existing conditions, which increase the risk of dying or suffering more severely from COVID-19, which is conditions like I mentioned, chronic obstructive pulmonary disease, cardiovascular disease, and these ultrafine particulates exacerbate inflammation in the lungs and the heart, leading to a higher likelihood of people exposed to them to develop these conditions, which then predispose them to a higher risk of fatality if they catch COVID-19.
When I looked at your map, and it showed where the highest levels of these fine particles are to be found, I see not only Roxbury and East Boston, I also see the South Boston Seaport District. So I'm trying to picture somebody in a luxury housing unit. Are they necessarily experiencing the same problem?
Well, that brings up a good point. You know, we were looking here at where people's residences are. It's not necessarily where they are all the time. Obviously, people now during the current crisis, people are home more often, but generally speaking, the only people who are regularly home all day long tend to be people in, you know, maybe senior citizen facilities or things like that. But a lot of us leave, we spend time outside, we go to our jobs, our kids go to schools. And so it's not just where people live, but where people do live, there's a range of ways that their house could be more or less permeable to these pollutants. I would imagine being in the top story of a nice glass tower built a few years ago in the seaport, you're not with a nice new HVAC system that's filtering the air coming in is not going to be the same as a triple decker in Dorchester that's potentially leakier, more ground level, more exposed to some of the ambient pollutants outside the buildings.
Well, one of the things you identify in the report is that a lot of this problem is not just vehicles in general, but bigger vehicles that use diesel fuel. What can be done about that?
Well, you know, when we think about what we would want to do to address this particular problem, and there's a variety of problems with air pollution and traffic congestion. They have sort of multiple impacts on different populations in different parts of our economy. There's a range of solutions or you know policies we could enact from the local scale to the regional scale, the state scale. At the highest level, there's this ongoing push in Massachusetts as part of a collaboration with a dozen other states in the Northeast called the Transportation Climate Initiative to, you know, reduce the amount of fossil fuel driven traffic through vehicle electrification, through, you know, shifting people to different modes of transportation, improving transit, pedestrian and bicycling, you know, accessibility. And that's sort of on that would be sort of on the supply side of the pollution where it's being generated. On the other side of the coin, investments locally to improve the flow of traffic, reduce the idling of trucks, as well as retrofitting buildings with higher quality air filtration, not building new buildings without high quality air filtration, not siting parks and schools alongside big roadways. So there's this whole collection of things, both sort of on the transportation system side and on the side of, you know, buildings and housing and how we go about, you know, equitably distributing, you know, opportunities to live in safe, healthy neighborhoods.
Plus, of course, as your report notes, this is all made worse by things like pollution or maybe even whatever adds up to a heat island effect that would compound things. By the way, if people want to see these details, you've got this online. Is there some place where people can find it?
Yep, all of the data, the report is on mapc.org. You can download the data yourself and go, you know, block by block to look at your own neighborhood or, you know, streets that are interested to you, of interest to you. The data is all free and open source for anyone to use. And ideally, we would like to keep on updating this to bring it into the conversation on a regular basis when we go about making, you know, policy recommendations and decisions on how to have people living in safe, healthy neighborhoods.